Welcome to the Health Conscious Living podcast. I'm Dr. Gail Myers, and today's special guest is Dr. Betsy Greenleaf. She's a premier women's health expert and trailblazer as the first female in the United States to become board certified in urogynecology. She has specialized in female pelvic medicine and reconstructive surgery for over 20 years. In 2018, she was honored with a Distinguished Fellow of the American College of Osteopathic Obstetrics and Gynecology for her service and dedication to the field. She is a sought-after speaker, teacher, and advanced trainer for medical societies, associations, and corporations. She is the spokeswoman for the American Osteopathic Association, with numerous quotes appearing in many media outlets. She is the best-selling co-author of You Were Made to Be Unstoppable. She's the CEO of the Pelvic Floor Store, an online store dedicated to finding reliable pelvic health products. She is the host of the Sum of Your Parts podcast, the Body, Mind, Spirit Internet Show, and her new podcast, Pleasure Forever, with co-host and sex therapist Marissa Nelson. She was recently awarded the Future of Healthcare Impact Award at the prestigious Mindshare Summit 2021 for her TED-like talk on the brain-gut-vagina connection. Dr. Greenleaf is a holistic body, mind, spirit approach to healing and wellness, and believes many of the answers to a healthy life are found within. She views her role in life as your wellness guide. So thank you, Dr. Betsy, for joining us today.
Oh my goodness. Thank you so much, Dr. Gail. I'm so excited to be here.
So Dr. Betsy, tell us about what inspired you as a pioneer to become board certified in urogynecology.
That's a funny question because people always ask me, like, how did I end up in that field? And it was definitely not something that I started off medical school thinking I wanted to look at women's, down the hair all the time. But it just kind of happened. I actually started off as a general surgeon, and I found that though general surgeons are wonderful people and we need them, I found them to be more like body mechanics, like just get in, fix the parts, and then get out of there. And I wanted to have more of a relationship with my patients. So I was the resident on our rounds that would be talking to people like, so how do you feel now that your gallbladder is removed? Or how do you feel now that you don't have an appendix? And, there really wasn't much room for that in general surgery. So then I switched into obstetrics and gynecology because I really was interested in women's health and just the whole person and not just, the parts.
And so at that time, there was not a board certification, or how did that happen that you blazed that trail?
It's interesting. So urogynecology, and the funny thing is when I first came home and told my mom that I was going to do more training in urogynecology, she didn't know what it meant. She's like, Euro. She says, is that like European, like fancy gynecology? So like Euro Disney. And I'm like, no, Euro having to do with urology, meaning bladder and the urinary system, and gynecology having to do with women's parts. And so that's a specialty that's new in the field of medicine, in that it's only formed in the late 1970s. And interesting enough, because of it having to do with urology, like bladder parts, and gynecology, women's parts, there were a fight for years between the urologist and gynecologist who was going to be in charge of the board certification process. So because of that unresolved fight, it took until about 2014 before there actually became a board certification in that field of medicine. But overall, it's a very new field, and there's actually about 1,500 urogynecologists across the country at this point in time.
Oh my goodness. So you trained in gynecology and then in urology and then put them together.
Yeah. So I did gynecology. Well, I did general surgery, then obstetrics and gynecology, and then urogynecology. Yes.
Oh my goodness. So we're so happy to have you here and have you in the world to help us out. So tell us about pioneering then in holistic integrative medicine and pelvic health.
Yeah, it's something that over the time, I'm traditionally medicine trained, so it wasn't something that was really part of my training other than being an osteopathic physician. So in an osteopathic medicine, we look at the whole body as a whole, but there wasn't a lot of this mind spirit aspect of things. And this was something that I sort of developed just over time with dealing with patients is when I got out into the real world and was practicing medicine, I was doing all the things that I learned in fellowship and residency and doing everything in the textbooks, and people still weren't getting better. And I'm going, well, wait a minute, I did everything that in the books. And then I started noticing these patterns of people, some of the patients that were a little more anxious that had more issues with pain. And I'm like, well, is the anxiety is the cause of the pain, or is the pain causing their anxiety? And it was kind of it just kind of all started coming to me. And I started finding different courses, connecting the dots, and started getting introduced to people that were more of a holistic mindset. And it kind of went down this rabbit hole, but it was one of those things that once you learn the connection between the body, mind, spirit, you can't unlearn it. And then it made so much sense. And so I always talk to my patients, and I talk to them about total wellness is like a three-legged stool, and that your three legs are body, mind, spirit. And if all those legs aren't equal, you're going to topple over. And this is what I would see time and time again. Let's say if I had a woman who like looked on the outside, the perfect health, meaning that she ate perfect diet and she was one of those people who like went to like CrossFit or like exercise like crazy, yet it was having all these other medical problems. And we were like, why is this? And we'd take a look at her life and the amount of stress that she was under, or maybe the lack of connection and community. So she wasn't feeding her spirit, that was all affecting the health. So this is where we're like, okay, you know what? We got to figure out ways to get all these areas of people's lives balanced. And, I think one of the biggest problems is for many of us in modern day is we're very busy. We put a lot of almost artificial stress on ourselves with like deadlines. The world's not going to end if you don't miss your if you miss your deadline. I mean, you may feel like it, but there's a lot of things that we do to ourselves that throw that balance off.
That's true. And what's fascinating is how you sort of, as you went through training, which happened for me, you go through training and you have this understanding, but there's no backup for it at the time. Now we know the field of integrative medicine is growing, and probably the largest field in medicine that's growing right now. And that's because we really understand the importance of it. And if there's ever been a time in history, this is really it to bring this forth. And so as you went along the way and holistic medicine and integrative medicine started to become more research-based, and the database and the knowledge base is now tremendous. And the brain gut system, as it connects to the whole, to immunity, to all parts of our health, and now to pelvic health. Tell us about that. Why is pelvic health so important for women and men?
It's something that I didn't connect until pretty recently. And I think it started off more, there was a combination of two things that were going on at the time. So for about the last 15 years, I've been testing the vaginal microbiome without realizing I was testing the vaginal microbiome. Like I wasn't calling it the microbiome. And just to go over the microbiome really quickly, is it's the small environments in our body that have different organisms, so that the bacterial balance in the vagina is different than the bacterial balance of our skin versus the bacterial balance of our gut. And so I wasn't thinking that I was doing that at the time, and I didn't see the connection between all the systems. All I knew is that when I first came out of training, we were doing a lot of vaginal mesh implantation. And so if people have stayed up late at night, you probably see the 1-800 bad drug commercials, like, have you been injured by vaginal mesh? And with that being a whole conversation in itself, mesh itself wasn't bad, but I had to figure out, why were people having problems with mesh? And so I started thinking about, well, anytime we implant something in the body, you want to implant it into a very clean area. And pelvic surgery is not sterile, it's not clean. The vagina is filled with bacteria. So I started wondering, like, was the bacteria in the vagina having an effect on people having problems with their mesh? And so what we started doing was about 15 years ago, we were doing these swabs that actually looked at what bacteria was present in the vagina. And there was no research supporting this at the time. But if I found bacteria that I thought was kind of a little out of whack, then I would treat the patients before we put in the mesh, and they had less issues with the mesh. Now, fast forwarding, I started not believing in mesh surgery as much. And as I started getting into more integrative medicine and wanting to figure out how to heal the body, I started looking into, well, what was throwing off these bacterial balances in the vagina. And then I started having my own health crises. All of a sudden, I had 2 kids. And within a matter of like 3 years, I had 2 children and a hysterectomy, and was blaming all my issues on hormone imbalances because I had had my ovaries out. And I thought, well, this is all hormonally related. But I was having issues with anxiety, depression. I wouldn't necessarily call it depression. I was just angry all the time and having like a lot of problems with anxiety. And then I found myself getting sick all the time. And it wasn't until, and I was, doing this stuff for patients, looking at their gut microbiome. At this point in time, I knew a lot about the gut brain connection. And because this was something that was out there in integrative medicine, but I didn't think about it for myself until all of a sudden one day I was like, wait a minute, like I'm seeing an immunologist and they're telling me that I have this primary immune deficiency. That's something that's hereditary and it shows up in your 40s. And I'm like, I hit my 40s and I'm falling apart. Like, what is going on? And then one day the light bulb went off above my head and I'm like, wait a minute, what is my like immune system and my anxiety have in common? And I went, oh my God, the gut. Because 90 to 95% of our happy hormone, serotonin, is made in our gut. 80% of our immune system is made in our gut. And I went, oh, wait a minute. So then I set out to test my gut microbiome and then balance my own gut microbiome. And next thing you know, I'm like off antidepressants. I'm not getting sick anymore. My immunologist is like, I did my testing and she's like, I have good news and bad news. She's like, the good news is all your lab numbers are normal. She's like, the bad news is I have no explanation for why this happened. And I knew it was really because of the gut microbiome was balanced. So then that made me start thinking about, wait a minute, what was the connection between the gut and things that I was seeing in my patients in the office, like chronic pelvic pain, chronic inflammation, recurrent urinary tract infections, recurrent bladder infections. Before I had gotten to that point, without really making that connection, I did notice that my patients that were getting chronic yeast infections, that if we did therapies to like chronically decrease the yeast in their gut, even without testing it. I didn't know that. I was just like, oh, let's just treat the yeast in your gut, that their vaginal yeast infections got better. So like all these things were starting to come together. And then all of a sudden one day I'm like, wait a minute, and started testing patients, their gut microbiome, starting pairing it to the vaginal microbiome. And we were starting to see differences in that. If I could improve their gut, their pelvic health got better. If I improved their gut, their mental health got better. And so this was all really connected. And then I ended up going into a deep dive into the medical research to find out if there was anything that was supporting this. And at the time there wasn't. And but since then, we now are finding that the researchers are doing a lot more research now on microbiome, and they are finding out that if the bacteria in the vagina is off, that there's this feedback loop to the brain because the body does not want to reproduce in a time when things are not ideal. So everything has to be perfect for the body to want to reproduce. So there's this feedback loop that they're trying to figure out exactly the pathway that this is happening. And this is what they're working on right now, that it will dampen sex drive. It will dampen all the hormones of reproduction. So if microbiome of the vagina is off, we have more problems with sexual dysfunctions and we have more problems with fertility. And this was really amazing to me that I'm like, oh my goodness. All right, the brain and the vagina and the gut are all connected. And maybe we can make a difference in these areas if we understand that how this bacteria is working on our body. I mean, when I had my two toddlers, I was the mom who was running behind them with the antimicrobial soaps, thinking like bacteria is bad, germs are bad. And now, through what I've learned through research and working with patients, really, we can't live and survive without bacteria, that we're working in this symbiotic nature with each other.
Yes, and especially the healthy ones. So I think we might want to, for the audience, back up a little bit and talk about the gut and why the microbiome of the digestive tract is so important, having to do with our immunity. 70% of our lymph tissue is in the gut. And the bacteria, we're learning so much about this. This really kind of is a new field that is unfolding as we speak. But we know that the bacteria really are our first line of immunity in the digestive tract. And they make intrinsic factor and help us to digest, and they help us to strengthen the immune system and help us create antibodies. And there's so many parts to the gut, that the digestive tract, that is key to our immune system. And so this is brilliant. So now that you've made these connections and you've been able to help a lot of women, no doubt, talk about the diet and what disrupts. Let's talk about what disrupts the microbiome in the gut, and then what disrupts the microbiome in the vagina.
Sure. And this is something too that I think back, like I grew up in the 70s and we were eating Wonder Bread and, I think of Wonder Bread and Twinkies and, all these like processed foods. And that's what's showing that, didn't evolve to be eating these processed foods. And so unfortunately, the standard American diet, which is highly processed foods, fast foods, high sugar, high amount of dairy and gluten from wheat, like a lot of these inflammatory foods can affect our gut. And the other thing is how our food is grown. So a lot of our foods contain pesticides and insecticides, and those things can further throw off the balance in the gut. And then actually things like stress can actually further throw off our gut health. But that becomes very circular, because if we stress our system by eating these inflammatory foods and now we develop these medical problems, then that's a stressor. And then we're stressed because we're having these issues. That becomes a stressor, because that becomes very circular. So what ends up happening is the lining of our gut is really very protective for our body. It keeps a lot of these toxins and these inflammatory things from getting into our body. But when we're constantly exposed to the environmental toxins in our food and these inflammatory foods, it actually causes our intestines to become inflamed, and we lose that protective barrier, because now there are gaps in the lining of the intestines, and now these things can enter into our body and trigger inflammation. And I think the interesting thing is that it's not like everybody that has leaky gut, which is it's termed leaky gut when you get that inflammation, things are now leaking into your system. It's not that with leaky gut that everybody has the same symptoms. There's some people, they can get worsening of their autoimmune diseases. Some people, like I see all the time, get recurrent pelvic infections. There's some people who get worsening of their arthritis. And they're even finding that certain bacteria that we just pick up in our environment and through our food are actually leading to different things. There's certain bacteria that are associated more with like rheumatoid arthritis versus other types of bacteria. There's certain bacteria that are associated more with constipation. There's other ones that are associated with diarrhea, and some that are associated with autoimmune disease. So it's interesting what they're finding out about how these bacteria are working in the body. So I always tell people the best thing to do is actually to eat a whole diet, meaning that if it's eating things that are like walk, fly, swim, or grow, those would be like my because Twinkies don't grow on trees. Sorry for the Twinkie people, but Twinkies don't grow on trees, so that wouldn't fit into the walk, fly, or swim or grow. And we were really meant, we were, cave people. There was no refrigeration. So we were eating a lot more bacteria in our food. And so we can replace that now with fermented foods. So whether that's like sauerkrauts or kimchi, or even though I say dairy can be a problem, I kind of give yogurt a pass and some of the fermented dairy products because of the fact that the bacteria used in those will break down the milk sugars. And as long as you're a person that doesn't have a problem with dairy, those can be okay. But, adding those healthier foods into the diet can really make a difference in balancing out a lot of these processes that cause inflammation and disease in our body.
Yes. And in addition to eliminating or reducing sugar and wheat and gluten, which disrupt, alcohol is another one that really disrupts the gut microbiome. And as much as we have, and as much as antibiotics are important when they are needed, that's another major disruptor in the gut microbiome. And so as we learn more about it and people are educated about it and can begin to see that, there's this connection, then what happens in pelvic health? Why is that diet so crucial to pelvic health?
Yeah, more so for women than men, but we'll talk about for men, for example, it can affect men's health too, because if the gut is off and there's inflammation in the gut, that's a stressor on the system. And so anytime any of us, male or female, are stressed, the hormones, sex hormones like testosterone, estrogen, progesterone that we normally think that affect our reproductive health, they're also in the same pathway as our stress hormones. And so what happens is when we're body stressed, all those hormones that are being made by the body will be converted into stress hormones, and it sucks away our sex hormones. So it sucks away all that energy from fertility and reproduction. So if the gut is inflamed and off, this can also affect men's health too. So this can affect sexual function. This can affect drive. This can affect testosterone production. Therefore, testosterone production can affect muscle mass and any of those the secondary sexual characteristics, like even hair growth. And so it can affect men, but also in women, even more so, because of the way we're built with the rectum and the vagina and the urethra, which is the tube you keep through, are very close to each other. And so what happens is no matter how clean you are, no matter what hygiene you do, whether you would wipe properly or improperly, that bacteria can easily pass back and forth between those three areas of the body. And so if the gut bacteria is off, the first place that can throw off bacteria would be in the vagina. And the vagina then acts as a reservoir. And sometimes people don't even have symptoms. Sometimes people will get like a fishy odor or a bread-like odor, depending on if it's a bacterial infection or a yeast infection. But sometimes there are no symptoms and, could just show up as problems with fertility. It could show up with problems with sex drive. And a lot of women blame their sex drive on their hormones, and they're showing up at their doctor's office going, I need hormones. And they're getting hormones and they're still not having a sex drive because it could be getting dampened by this bacteria in the vagina being thrown off. But the other thing that we see with the bacteria in the vagina is that now the vagina is a reservoir for the bladder. And that because now it's a little bit closer to the urethra and the bladder, women can get recurrent urinary tract infections. So that these are some of the symptoms. The other thing, if the vagina is off in women who are pregnant, this puts them a higher risk of miscarriages, puts them at a higher risk of preterm labor. So delivering babies early. So we know that really keeping that vagina microbiome balanced is the way to go. And the first step is to make sure that the gut is healthy. And then the second step is to make sure the vagina is healthy. And some of it is related to hormones. The women who are menopausal, who are on birth control, who are pregnant, and who are breastfeeding all have very low levels of estrogen. And the vaginal tissue responds to estrogen. It's what triggers that tissue to grow thick and healthy. And when that tissue is actively growing, the new cells are pushing out the old cells slough off, but they contain something called glycogen, and glycogen is the food source for the healthy bacteria. So as long as estrogen levels are normal, the healthy bacteria in the vagina is fed, and the healthy vagina protects us from the bad bacteria from the gut in that it actually produces peroxide. And so the peroxide makes the vagina very acidic. And when the vagina is acidic, it chases away the bad bacteria and the yeasts. So everything has to be like, perfect balance. And you kind of like wonder, like, how did we develop this way? But I think, in modern times, due to stress and poor diet, we're at much higher risk of having these balances kind of being out of whack versus when we were, probably cave women, walking across the savannah. We didn't have a lot of those other factors that were coming in, throwing off this microbiome balance.
True. And of course, we've just been like through and still sort of tailing the pandemic. So that stressor for all of us is there.
Yeah.
And, understanding this beautiful balance, because the other thing is that we know the body is designed to be healthy, and it's so intelligent. And the immune system is exquisitely intelligent, and so is the rest of our biology. And so when we understand about our environment and the power that we have to create and to rebalance and have our optimal health through diet, lifestyle, all the lifestyle health habits of which this is extremely important. We'll talk about probiotics, and then I'd like you to talk about what does a healthy gut microbiome pelvic health look like in a woman and a man?
Sure. So, well, going back to the probiotics, I know a lot of people say, well, why not? Can I just take probiotics? And for the most part, you can. That doesn't, there's a lot of research now that's coming out on probiotics, especially for women's health. Up until about 4 years ago, all we had was one study out of China that said it took about a month of taking probiotics for those healthy bacteria to now re-inhabit the vagina. But they've done some newer studies on different types of probiotics. And so the probiotics are really just any bacteria that boost your system, ones that normally are found in the intestines, normally found in the vagina. The ones that typically are found in the vagina that are usually the kind of the best is the lactobacillus species. So when people look at your ingredients on a probiotic, the ones I particularly like when I'm looking for a probiotic for women is something called Lactobacillus acidophilus, Lactobacillus. There's a couple other ones, Gasseri, which is Gasseri. I might have the spelling wrong. Lactobacillus rhamnosus, Lactobacillus. There's another one I'm blanking. There's a couple that I like. There's KCI and Para-KCI. And so there's a bunch of them, but pretty much the Gasseri, the rhamnosus, and the acidophilus are the ones I tend to look for women's health. But, it's interesting that they're even just finding out what some of these bacteria are doing. They're finding out that some of them are actually helping to produce some of our hormones. So I think as we get more and more into the research of this, they're going to be finding out specifically, if you're having mental health issues such as depression or anxiety, which are the probiotics you should be taking for that. And I think we're just on the edge of that kind of information. And going back, and you were saying the other question you had was about what does the healthy gut microbiome look for both men and women.
Mm-hmm. In relation to pelvic health.
Yeah. So, well, I think one of the biggest things that we see a lot often on testing, and that's something that if you are interested in, there are stool tests. There's a lot of different companies out there. There's one that I particularly like, but we do stool testing to actually see what is the bacteria in the stool. Mm-hmm. And one of the interesting things that we see a lot in people is high levels of something called H. pylori or Helicobacter pylori, which is in traditional medicine. I was always told this is the bacteria that's associated with stomach ulcers. This is a bacteria that's associated with certain stomach cancers. But when you look at the research, they're saying is that 50 to 90% of people actually have this bacteria present in their gut. And so usually it's in the stomach area. But the fascinating thing about this bacteria is that it only likes to live in low acid environments. And so I've been questioning this idea of being on low acid foods or this low pH water. And I don't have this answer quite yet, but for years, especially when I'm talking about pelvic health, I would make sure patients for their pelvic health were on very low acid foods because high acids can affect the bladder and in both men and women and in the pelvic health. But now I'm starting to question that is these low acid, like these pH balanced waters that are very basic, are they healthy for us? Or, we see people who are living off of Tums and Pepsid and things that lower stomach acid. And are we doing more harm than good by lowering the stomach acid? Because that promotes more of this H. pylori to grow. And once the H. pylori is there in the stomach, and that's what I find for most people, that's the big problem that throws off the rest of the gut. So as long as the stomach acid is low, the rest of the gut is thrown off. But we also know that stress affects stomach acid production, that if you're under stress, you're not, it's kind of like when your sympathetic nervous system has kicked in. This is the system that keeps us healthy when there is a threat, So if you're walking across the savannah and a lion jumps out, this is not time to be digesting your hamburger or to be reproducing. So digestion and reproduction gets put on the side and all the energy goes into fight, flight, or fright. So you're either going to fight that lion, run away from the lion, or stay incredibly so still that the lion doesn't see you. Well, this is going to, if you're constantly under stress, it's going to affect stomach acid production too. And in low stomach acid environments, now we're more prone to this H. pylori, and we're more prone to throwing off the whole microbiome, the whole downstream from the intestines all the way down to the rectum. So I think that one of the ways I have people, I always say check with your own personal doctors first before doing this, but I have people adding a little bit of apple cider vinegar into their water. So to help raise stomach acid, to help with digestion. And there's a bunch of other techniques that can be done with that too.
Or lemon juice if they can tolerate it.
Yes. And I think this is one of the reasons why when we see in traditional medicine, when they treat H. pylori, that a lot of the treatments aren't very effective. Usually the traditional treatments are you have to go on like 3 different antibiotics and you have to be on usually something to lower the stomach acid. But I'm like, that's still just creating an environment that the H. pylori wants to be in. So I think the biggest key that we're learning with these bacterial balances is really creating environments to have the healthy bacteria thrive and creating environments that want to chase away the bad bacteria. So we know, for the vagina, for instance, the vagina is very acidic. Let's say the pH of water is 7. Normal pH of a vagina is 3.5 to 4.5. That's very acidic. And so we know that sometimes, forget about probiotics or healthy bacteria, doing things to raise the acid level of the vagina can help to balance out the microbiome. One of the key things that I like to use is using boric acid suppositories. That you can pretty much find them anywhere, they have them in the pharmacies, they're in some of the supermarkets. There's when I was practicing medicine for years, we used to have those things made up specifically by compounding pharmacies. And they weren't always easy to come by. And now you can just buy them over the counter, though I always say check with your doctor first. But like my favorite brand is PhD Feminine Health, but you can pretty much find those anywhere. So that's something just by learning how to affect the acid levels of certain environments to encourage that bacteria to be present. And then this would be too why alcohol would throw off your bacterial balance, because that's going to change that environment of the intestines and kind of, kill off any of the healthy bacteria. So we really want to be doing things that encourage this microbial balance. And now I'm talking, interesting thing is I'm talking here from a medical standpoint. I was talking before about that three-legged stool, but I end up tending to get super focused on the body aspect because that, as a doctor, those are the things I can make a difference in. But I'm sure, and I haven't looked this up, but I'm sure that there are studies looking into meditation and affecting acid-base balance in the body. I would not be surprised to find that. We do know that things like meditation can improve healing and therefore, decrease those stress hormones. It's going to shift your regular hormones into production of those sex hormones. So we do know that specifically. I actually haven't looked into whether it affects acid-base balance, but I wouldn't be surprised if it did.
No, I haven't either, but we do know that meditation rebalances the sympathetic, fight or flight, and the parasympathetic, rest and nest and digest. And it lowers cortisol levels. And so that in and of itself, exercise, sleep, hydration, and meditation and what you eat can all affect the gut microbiome and then all the pearls that you have given us today. So thank you. One of my last questions is, what does the health look like? We've talked about what the imbalance looks like, but what does the health look like? So what's the goal that women can look for, men can look for in achieving or having and living?
Yeah, sure. So, having a balanced microbiome, whether it's a pelvic microbiome or a gut microbiome, what it tends to look like is there's a couple different factors. Number one, we tend to have a lot more energy, much less aches and pains, if any at all, much, improved sex drive, improved fertility. We also end up have better weight control because they're finding that the microbiome of people that are obese is different than someone who is of regular weight. So they're trying to find ways to shift that microbiome to people that trying to shift the microbiome of the obese patients to the ones that have a normal and see if that's affecting weight control. When we do know that when the microbiome's out of whack, this will affect food cravings, especially if we're overgrown with yeast in the gut. Yeast will trigger sugar cravings like crazy. It's almost like the yeast takes over your brain and tells you eat more sugar so it can get more sugar. So less food cravings, better body composition. There's actually a new study too that I was fascinated with, that they're finding that their circadian rhythm may not all be just based on daylight and night cycles, that they're finding that there's certain microbiome shifts that occur in the body outside of exposure to sunlight that may keep the body in more of a regular kind of cycle and functioning. So I think, we also see, hormone balance. You're going to see improved sleep when you have the microbiome balance. So I really think that as we get more into this research, we're just going to find that these little tiny itty bitty baby tiny microorganisms really control so much of our lives that we didn't really even know, and that we're going to start learning how to kind of support and nurture those bacteria in our body.
That symbiotic relationship that we have, those bacteria that are helping us out. So we have to help them out. Over the last almost 20 years that I've worked with patients with their gut microbiome and restoring that, everything you mentioned, and especially the sleep, because when the gut is out of balance, it wakes you at night. And then, as that gets restored, you have much better sleep and better mood, that you have that energy, your outlook is better. You have a more uplifted outlook on life instead of that sort of toxic feeling that we get when things are out of balance. So there's much to look forward to, and you've given us so many pearls today. So thank you so much. And
Oh, thank you so much, Dr. Gail.
you're welcome, Dr. Betsy. How can people follow you? How can they reach out to you?
Sure. So the biggest way is just follow me on social media. So I'm pretty much on every single platform there is in some way or another, because I've had to, because I talk about pelvic health, which tends to be a little bit on the taboo side. I've actually lost some of my social media over time. So if you just look up Dr. Betsy Greenleaf, you'll probably find me. It may not exactly be, that might not exactly be my handle, as long as I don't upset the social media people too much, because I tend to, just speak the truth. And so find me on social media. Also, we're going to be updating, my website is drbetsygreenleaf.com. Also, you can also find information on the pelvic floor store, and but mainly social media is probably the best way, because that's where you'll see all the announcements about upcoming programs and summits that I'll be doing.
Wonderful. Well, thank you again, Dr. Betsy, for your time. And that will all be in the show notes so people can reach out to you. Thank you again.